So Spain has been hit rather hard by coronavirus. What kinds of procedures are still going on in Spain right now in ophthalmology, if any?
Yeah, first of all, we were informed late about the problem in ophthalmology. I mean, because our authorities were very inefficient in alerting the population and the healthcare professionals about measures to take, care that we have to undertake institutionally. And under these premises, we had a relative period of 1 month in which nothing was happening, even that we knew healthcare professionals that something very wrong was happening worldwide. I was traveling at that very moment, and so I was aware of the limitations in some airports and the controls in hotels. Meanwhile, we had nothing here. And so having this in mind, we had a period in which life was normal, but was not normal at all. So we have a huge contamination problem, huge. And immediately after then, the epidemic outbreak happened. Many people became sick immediately, and all of them are all of a sudden they had to go to hospitals. Hospitals were not prepared, obviously, for this massive the demand of medical attendance, especially in intensive care units, and that made the collapse of the system. Ophthalmologists were called to make primary attendance. So ophthalmologists, especially young ophthalmologists, those that were recently in the medical school, residents, young staff from hospitals, they had to cancel all the ophthalmology activity, and they had to go to the emergency departments to welcome patients, to attend patients, to control the respirators, to control the general intensive care of the patients. So even that, but
Yeah.
without adequate protection. That means the protection and the lack of protection to healthcare professionals to have a 25% contamination in the healthcare profession, which is a tragedy. So many of them were contaminated. We have a couple of them already have died because of this problem. And the condition has been very poorly managed in Spain. Our authorities were and are much more concerned about political issues that are not the real life, unfortunately, that the real problem that we had. And that made ophthalmology to be collapsed as well, because all the activity, which is your question, was cancelled by the authorities. Elective surgery was totally cancelled 1 month ago. We could make all surgery only in emergencies departments. Not only that, our respirators in the hospitals were taken from the ophthalmology units and the private hospital as well, what made that now they cannot start work because anesthesiologists refuse to make surgeries without having a ventilator system in the operating room. So ophthalmology is very much damaged. First, the activity has been totally stopped, totally, only emergency. Emergencies are like retinal detachment and the problems that are severe enough to demand urgent care. Second, elective surgery cancelled. Number three, ophthalmologists devoted to general practice, general medicine, used as task force for the healthcare system, made them not even to be available for ophthalmology. And now the condition is, in my opinion, very easy to understand. We shall have a huge waiting list for everything. The patients needs to be attended for glaucoma, needs to be attended by intravitreal injections, needs to be attended by the many problems, the dry eye, allergies in this moment of the year, etc., that makes our offices to be very busy always. And we have not a specific plan to attend them. So I think that we shall have went back a huge delay in the attendance. We shall have quite a collapse of the system, and we shall take months. And I don't think that we shall be solving this problem before 6 months, believe me. It is more than 50% of the ophthalmologists that are devoted to general care, general
Right.
health.
Did you find yourself in there also having to help out with cardiac equipment or other equipment?
Not me, because I am in academic issues, and I have not been demanded to be there. Even that I would like that. There's no objection, but obviously you need to be assisting another physician. You
Right.
cannot make decisions by yourself, because we don't know even the dosage of medication to stimulate the heart or to make an adequate care in somebody in which an emergency relating breath or cardiac problems are happening. So we can be assisting, we can take marginal responsibilities, but we are not updated. But in my case, I have not been demanded to be there so far. And we shall need to make normal life because the country is collapsed at this moment in the economy, which is the second problem. How we are going to solve the economy, the labor, all the social consequences is the tremendous. Probably we're now in the hardest part in terms of emotions. But later on, we shall be in the hardest part because of economy and socio-financial problems. We have had a tremendous lack of organization, tremendous lack of protective supplies, protective healthcare supplies, no
Right.
mask, no adequate protection in the hands, no guidelines, no protocols, and this is because our authorities are awful. Authorities are political authorities. They are not experts. They don't care about the experts. They don't care about the opinions of people who knows. What they want is to create opinion, and the opinion now is negative. I have to tell you that what they try to create opinion is probably raising a negative opinion because everybody is aware that we're the leading country in casualties per coronavirus, which is in a modern country with a good healthcare system in which we have very good professionals. Really reveals that we have had a lack of planification and execution.